In this video, we're going to take a look at some analgesics, specifically mild analgesics such as aspirin. So to kind of get started, we first need to talk about what analgesics are. Basically, they're drugs that are used to relieve pain, and there are two main types. Mild ones, which are used for the relief of mild pain. So things like aspirin or ibuprofen are good examples of mild analgesics. And then we also have strong analgesics. So that's for very, very severe pain. We're not going to look at these too closely at all actually in this video, but we'll take a look at them in a separate video. But those are things like morphine, heroin, and codeine. So when we talk about pain, we need to talk about how pain actually works in the body. Pain is felt or detected by the brain when nerve signals are sent from various pain receptors that are located around the bodies. And basically, the pain receptors are stimulated by a molecule called prostaglandins, which are released from cells that are damaged. And they're damaged by various means. Thermal means like if you burn yourself, that's what you would feel. Mechanical is something mechanical. So, basically getting any kind of cut or something like that, or a broken bone, that would be mechanical, and could also be chemical energy as well. And so those prostaglandins, it's actually quite a complicated process, but basically they mediate the inflammatory response. And when they mediate that, it allows for dilation of the blood vessels near the site of injury, can also result in a fever, increased body temperature, just to help try and mediate this inflammatory response. So mild analgesics are things, like I said, such as aspirin or other non-steroidal anti-inflammatory drugs, or NSAIDs for short. So that's just the first letter of that whole big word, such as ones like ibuprofen. The way that they act is they prevent stimulation of the nerve endings at the site of the pain. And they do that by inhibiting the release of the prostaglandins at the site of injury, by inhibiting an enzyme called COX, or cyclooxygenase, which is a key enzyme basically in that pathway to synthesize prostaglandins. And so by doing that, it gives relief to both the inflammation and the fever, as well as the pain. Now, important to note, they are not narcotics. They actually do not interfere with the functioning of the brain. And so that sort of differs by the narcotic types of analgesics, which we'll discuss in another video. So aspirin, otherwise known as salicylic acid, is a widely used pain treatment as well as fever reducer. It's aspirin's kind of interesting though, and we'll take a look at the structure in a minute, but it's a relatively strong acid, so it's unpleasant to take orally, and can damage the membranes lining the mouth, the esophagus, as well as the stomach. So instead, what they do is they create a sodium salicylate, or basically it's its salt. So it's sodium salt of this salicylic acid, can be used, but can also irritate the stomach. And so instead, what we take today is actually the ester form of aspirin. So it's the acetyl salicylic acid, or ASA. It's named aspirin. It retains all the beneficial properties of salicylic acid, but it's less irritating to the stomach. And it also is relatively tasteless, so it's a lot easier to take orally. So looking at the structures here, then, you can see salicylic acid, it has a carboxylic acid, so it has a carboxy functional group, and then it also has a hydroxyl functional group. So the acid here it's essentially a carboxylic acid with that hydroxy group there. In acetyl salicylic acid, you still have the carboxylic acid, but now we've taken that other OH group here and we've created the ester here. And so that's what gives it its properties and makes it a little bit easier to take orally. In terms of side effects, there are lots of positive side effects of aspirin. So it can reduce fever and inflammation, as I said before. It can also reduce the ability of blood to clot. So if you're at risk for a heart attack or stroke, it can be really useful as a treatment to take one a day just to make sure that the blood stays thin and doesn't clot up and cause a heart attack or a stroke. So sometimes it's taken as low daily doses for that purpose. And there is some research as well that sort of says it can reduce the risk of colon cancer. Not really as well known as a positive side effect, though. There are also negative side effects of aspirin. So the biggest ones being irritation and even ulceration of the stomach and the duodenum, so the first part of the small intestine, which can possibly lead to bleeding. And you can also have allergies to aspirin. So if you're allergic to salicylates, you're allergic to aspirin, really more prevalent in folks who have asthma. It's more common. It's also not recommended for children under 12 because it has been linked to a disorder called Ray's syndrome, which is a rare and potentially fatal liver and brain disorder. Now, one other last concept we're just going to talk about briefly here in this video is called synergism. So what synergism is it can happen when you take two or more drugs given at the same time, can have an effect on the body that's greater than the sum of their individual effects. So aspirin can cause bleeding in the stomach, but if you take it with alcohol, which is another drug, it can actually result in a much higher risk of that bleeding happening in the stomach. So really important to keep in mind this synergistic effect when you're mixing different medications because it can cause worse sort of side effects when you take two drugs together versus taking them alone. So that's a really short, brief introduction into mild analgesics and especially a closer look at aspirin. That's it for this video. We'll see you in the next one.